Today I'm going to be talking about delegation and conflict management. Conflicts are inevitable in the workplace. It may be due to the difference in the way of thinking, values, and approaches between two or more people, as cited by Marcus and Huston, 2017. According to Janatson, 2012, conflict can be expressed as a misunderstanding between two or more parties who perceive a threat to their interests and concerns. One conflict I have faced in the workplace was when I transitioned from a CNA to an RN. I was a CNA for 8 years before becoming a nurse. In the beginning, delegating to a CNA was challenging for me since I was one of them. There was difficulties in the delegation of duties because anytime I delegated a task to any of my fellow employees, I would face some resistance using the phrase, when you were a CNA. To get away with the resistance, I found myself undertaking the task rather than delegating them to avoid conflicts. Taking the steps of avoiding conflicts and failing to come up with conflict management strategies may add up stress for the nurse and in return get poor outcomes, as stated by Jonathan 2012. Part of being a nurse is delegating, and delegating is for the needs of the patients. Delegating to subordinates cannot be avoided. Hence, avoidance was not an appropriate strategy to manage the conflict. Today, I would handle that conflict differently. Instead of avoiding, I will utilize the strategies of compromising and collaborating. Compromising is the attempt to resolve the conflict by identifying a solution that is satisfying partially to both parties. Collaborating is liaising with the other party to recognize and express each one's concern to come up with a conjoint solution, as stated by Freed 2014. Collaborating may lead to shared responsibility for the desired outcomes and is reinforces mutually trust and respects, which makes this strategy much more fitting for this above scenario. So in my situation, the before, I guess I would mentally prepare myself by having done homework in reference to the conflict itself. During, I would show techniques about how great to be a role model would affect the outcome of the current conflict. And after, I would reinstate what is agreed upon on both sides. The process of delegation and the five rights of delegation. The process of delegation starts at the administrative level, where decisions are made to the staff responsible for the delegation of the task as well as overseeing the process of performance of the task delegated. The delegation process also involves empowerment of the staff members to make decisions based on their judgment, communicate effectively, as well as offer support from all levels of the healthcare setting. As stated by NG&D 2016. Delegation consists of the five rights, namely, right task, right circumstance, right person, right direction or communication, and right level of supervision and slash evaluation, as stated by NG&D 2016. If the RN goes by these five rights, the delegation he or she may make less errors while delegating. When it comes to the rights, the task, the RN can make an error, but giving the CNA a procedure that is not in their job description, and therefore a registered nurse it is necessary to clearly understand the procedures to follow. Another error, another error a RN may run into would be not having effective communication with the CNA. The RN should make sure that the CNA understands the procedure being done, and the CNA should ask the RN questions achieve the effect of communication, feedback from the person being delegated the task. Creating a healthy work environment. A good working environment is one that has a legal and professional responsibility to provide patients with these services free from dangers that are likely to cause psychological or physical harm to the employees or the clients. A healthy working environment compromises of true cooperation, skill communication, appropriate membership of staff, reliable governance, operational decisions making, and meaningful appreciation of the nurses and their impact, as stated by AACZ in 2016. The work environment at my workplace, has not embarked all these constitutes of a good working environment. Skillful communication has come up as a challenge because some nurses do not communicate well when they are faced with high-stake conflicts. This can be resolved by changing the set of interventions as well as the organizational behavior, as stated by Mancini, Huddleston, and Gray, 2017. As an effective leader, acts as a bridging gap between the individual nurses and the organization. It is therefore essential for leaders to encourage and maintain a healthy work environment for the patients as well as the employees. This can be done by collaborating other leaders and identifying the obstacles to a healthy work environment. The leaders may also integrate all the 6 constitutes of a good working environment. Thank you.